You wake up. Your mouth feels like sandpaper. You blame the bedroom air. But for many people over 60, that dry mouth every morning isn't about the air. It's your body trying to tell you something. It happens almost every morning. You open your eyes, and before you even get out of bed, your tongue feels stuck to the roof of your mouth. Talking takes effort. Swallowing takes effort. By the time you've had your first glass of water, you've already stopped thinking about it. Because tomorrow, it'll just happen again. That's the part most people miss. It's not the dryness itself that matters. It's that it keeps coming back, night after night, without you ever asking why. My name is Dr. Liam Green. This channel has one goal: to help adults over 60 understand what the research really says about their health. In plain language. Today, I'm walking you through 4 hidden reasons your mouth goes dry at night. Each one tells you something about the rest of your body. Stay with me through all 4. Number 2 is the one most doctors don't check until symptoms get worse. And number 4 is the one people miss most, because it doesn't look like a mouth problem at all. Before we get into these 4, I need to give you one idea. Without it, nothing else will fully make sense. I call it the saliva signal. Here's how it works. Your salivary glands are some of the most sensitive tissue in your body. They need steady nerve signals, good blood flow, and balanced hormones to keep working. When something changes anywhere in that system, your airway, your blood sugar, your immune system, even a new pill, your salivary glands are often the first to react. That's the saliva signal. Dry mouth usually isn't the disease itself. It's the smoke detector going off before you can see the fire. Quick question before we continue. Do you wake up with dry mouth most mornings, or only sometimes? Drop it in the comments. I read everyone. Your answer might help someone else watching today. Reason number 1, sleep apnea. Let me tell you about Carol. Carol was 67, a retired librarian in Portland. She never needed an alarm clock. But her husband noticed something else. Long pauses in her breathing at night, then a sudden gasp. Carol just remembered waking up parched every morning, no matter how much water she drank before bed. Here's the problem. Most people think dry mouth from snoring is just mouth breathing, nothing serious. But it's often a sign that your airway is partly blocked during sleep. Your body switches to mouth breathing just to get enough air. And here's the twist. The drier your mouth, the worse the blockage tends to be. A 2021 study in the Postgraduate Medical Journal followed adults with morning dry mouth. It found a strong link between how dry their mouth was and whether they had sleep apnea on testing. If dry mouth comes with loud snoring, or your partner notices you stop breathing at night, ask your doctor about a sleep study. Don't just chalk it up to getting older. Reason number 2, blood sugar. Meet Manuel, 70, a retired bus driver in Phoenix. No one had ever told him he had diabetes. He noticed his mouth felt sticky and dry most mornings. He was thirstier than usual, too. He blamed the desert heat. Here's the problem. It's easy to blame dry mouth on the weather or a salty dinner. But high blood sugar pulls fluid out of your body's tissues, including your salivary glands. Over time, that can change how those glands work. Here's the surprising part. Dry mouth can show up before diabetes is even diagnosed. A 2025 review in Dimensions of Dental Hygiene, drawing on clinical studies of newly diagnosed patients, found that people later diagnosed with diabetes or prediabetes were much more likely to report a history of dry mouth and thick, sticky saliva. If dry mouth comes with more thirst, more bathroom trips, or tiredness you can't explain, that combination is worth a blood sugar check. Don't just reach for a bigger water bottle. If you're still here with me and finding this helpful, take a moment and type 2 in the comments. It lets me know you're watching and getting value from this. Reason number 3, your medicine cabinet. Eleanor, 73, a retired seamstress in Cleveland, started a new blood pressure pill. Within weeks, her mouth felt dry almost all the time, especially at night. Here's the problem. We expect side effects to be obvious, like feeling drowsy or having an upset stomach. Dry mouth rarely gets mentioned, but researchers have linked over 1,000 medications to less saliva. That list includes common blood pressure pills, allergy pills, antidepressants, and water pills. And here's the twist. The more pills you take together, the higher your risk. That's true even if no single pill is the real problem. A 2003 review in the journal Oral Diseases linked these effects mainly to a group of drugs called anticholinergics and found that taking several different medications together raised the risk even more than any single drug alone. Blood pressure medications, including diuretics and beta blockers, are also widely documented as a common cause of less saliva. Never stop a medication on your own. Bring your full list of pills, both prescription and over-the-counter, to your next appointment. Ask your doctor if dry mouth could be a combined side effect. Reason number 4, your immune system. Diane, 61, a piano teacher in Asheville, had dry eyes for years before the dry mouth started. She thought the two were unrelated. Then a rheumatologist, a doctor who treats joint and immune conditions, connected the dots. Here's the problem. This kind of dryness builds slowly, so it's easy to miss for years. A condition called Sjögren's disease makes the immune system attack the glands that make saliva and tears by mistake. And it doesn't stop there. Over time, it can also affect the joints, lungs, kidneys, and nerves. A 2023 study from the American College of Rheumatology looked at patients with confirmed Sjögren's disease. Almost all of them had ongoing dry mouth. Most also showed less saliva on testing. If dry mouth comes with dry eyes that don't get better with water, tell your doctor. That pattern is worth checking. It's not just a coincidence. I promised you something you can use, so here it is. 4 questions to ask yourself this week. Question 1. Does my dry mouth happen every morning or only sometimes? Daily dryness is the pattern worth tracking. Question 2. Is it paired with snoring, thirst, dry eyes, or a recent new prescription? That pairing often points to the cause. Question 3. Have I mentioned this to my doctor, or have I just been reaching for water? A 2-minute conversation can rule conditions in or out. Question 4. Am I protecting my teeth and gums in the meantime? Saliva protects your mouth from decay and infection, so sugar-free gum, sipping water through the day, and a dentist visit matter regardless of the cause. For Carol, Manuel, Eleanor, and Diane, dry mouth wasn't the real problem. It was the first clue that led to one. A simple conversation, a sleep study, a blood test, a second look at a prescription. That's often all it took. Your dry mouth might be nothing more than a dry bedroom, or it might be your body's quietest way of asking for a closer look. Either way, it's worth finding out.